So we've been talking a lot over the last day and into today about breast cancer awareness. That's the great thing about Pink in the Rink. When we do Pink in the Ballpark as well, we do a lot of things there, and we're happy to have with us here in the broadcast booth Dr. Malcolm Doyle right now from the, he's a ProMedica radiologist.
Yes.
Is that correct?
Yes, I work at the Breast Care Center on the Toledo Hospital campus, part of the ProMedica system.
Yep, and that's where we want to start. Let's talk about that facility right now a little bit.
I'm very fortunate to work at this facility. It's a one-of-a-kind facility in Northwest Ohio. We have a whole floor of the Harris McIntosh Tower, which is devoted to breast imaging. And we have a great team of compassionate nurses, technologists, and doctors that are all specialized in just breast imaging. That's all we do. And that enables us to give a level of care that you won't see at most places. The other great thing about it is because of our resources and the centralized nature of our breast care center, we're able to give very rapid turnaround. And we know that women that come in with a problem like a lump or breast pain, they want to know what's going on as soon as possible, and we're most of the times able to give them their answers on the same day they present.
Now, Doctor, we have some images as well that we would like to show talking about this, and why don't you take us through these?
Well, this is a picture of a mammogram, and this is what we use for screening. Mammograms are the breast screening tool available for the general population. They're not perfect, but they do a really good job. And one of the things I wanted to touch on, actually, there was a study that just came out of Canada a couple weeks ago that discredited mammography, and it was a really flawed study. The patient, I don't want to get into too much scientific, but the patient selection was flawed, the equipment was outdated, and there were actually some investigators on that study that dropped out throughout the study because the quality is so poor, but yet this still got mainstream attention. And I can tell you that there's been countless well-done scientific studies that prove that mammography saves lives, and I see it every day.
Yeah, well, you're right there on the front lines as we show some other ones there as well. And we've talked a lot about the last couple of days of how detecting early and
Absolutely.
and going through these kind of images and stuff that you guys do and are very good at has really helped that survivor rate get so high now.
That's right. Yeah, and as I said, mammograms aren't perfect. There are some women that have very dense breast tissue where the mammogram's less sensitive, and those women may need additional testing, such as MRIs or a study called MBI, and we have all that at the Breast Care Center. If you're one of those people that need extra testing, we're going to be able to identify you and help facilitate scheduling those extra tests.
Yeah, and that's where you still have to go to the first one, right?
Yeah.
Get through the first one and
get a screening mammogram every year from age 40 on. I strongly recommend it.
Well, there you go. Some great information as well. Doctor, great to see you again.
Yeah, nice to see you, Matt. Thanks for having me on.
Every year now. It's great. And what's great about it, too, is we're seeing that survivor rate continue to get higher and higher.
That's right.
Which is great with all the extra awareness, and I think that's where it all starts.
That's right.
Right?
Yeah, absolutely.
So it's fantastic, and always great to see you. Thank you so
so
much.
much.